Has your bleeding not settled down since you've had the baby? Or do you find that you're passing clots again, maybe the size of a coin? Or maybe even just changing your pad more often? Well, this video could literally save your life. Women know that at the time of delivery, you could expect to lose some blood. But what if your bleeding got heavier once you got home? I'm Remy, an NHS-based obstetrics and gynecology doctor with over 10 years of experience. I started Her Health Room to provide evidence-based and medically sound education and support in the postpartum period and beyond. In this video, I'm going to walk you through secondary postpartum hemorrhage. I'm going to tell you what it is, how it presents, so that you can use this information to go and seek help if it's happening to you or someone you know. Postpartum hemorrhage, which is heavy bleeding following delivery, is the leading cause of death in women at the time of childbirth across the world. It can happen immediately at the time of delivery, or it can happen at a later stage. And that's especially what we're going to be covering today. Multiple organisations across the world are doing their utmost best to reduce the number of women that are experiencing these massive blood loss and subsequently the number of women dying from it. So I hope you understand the importance of this condition and why we're going to discuss it in this video. By the end of this video, I want you to be able to walk away with the knowledge of the red flag symptoms that mean you need to take yourself to your nearest hospital. I was watching a video not so long ago on this very topic. It was a male partner who was actually recounting the events that happened once they got home after the baby was born. And to cut the long story short, they had floods of bleeding, multiple attendances to the hospital, and a delay in their diagnosis that required them to have further treatment in the form of surgery. And so we're not taking so long to get there. That's why I'm making this video. It is expected when you have delivered that you will experience bleeding. This bleeding is supposed to get lighter as the days go on. Most women can expect to stop bleeding by 6 weeks. If it was longer than 6 weeks, that would be a sign to go and seek medical advice. However, what if that bleeding isn't getting lighter, but is in fact getting heavier? That again would be a sign to go and seek medical advice. And then you might have, in some cases, where the bleeding is so heavy that you're having to change your sanitary products every hour, you're flooding through, passing out, fainting at home, needing an ambulance. Now, all of these things, I'm hoping, paint the picture that if it's not getting lighter, you need to seek help. Why is it that a woman might be having these symptoms after delivery? Well, there are multiple reasons for this, and one of this could be retained tissue. So at the time that the placenta is delivered, clinicians at the time are checking to see if the placenta is complete. There are a number of cases where the placenta comes away and there's either a little bit of the placenta or a little bit of the membrane left within the womb. And what the womb does is actively try to contract and squeeze that bit of tissue out. And in doing so, it often will lead to significant bleeding at the time. Now, if you're passing clots, that could be a sign that there is something left in the womb. Another reason is that the womb itself can become infected, and an infected womb becomes an irritable womb, which this may well present as bleeding. The other way this could present is with having a fever, smelly blood, and smelly discharge. And those are the things that I want you to keep an eye out for. There are other reasons why women could continue to bleed after the delivery, and that could be related to a multitude of things, including a bleeding disorder. If you were to have any of these symptoms I've mentioned, so just as a recap, bleeding getting heavier, passing blood clots, feeling feverish, noticing smelly abnormal discharge, or flooding and staining of your underwear and your bed linen, that's when you need to seek help. Now, in the UK, you can attend most maternity triage centres up to 4 weeks after the baby is born. You need to check with your local one. And that's where I would expect you to go first. You would then be seen by a midwife where they would want to check your blood pressure, they would want to check your temperature. If the report or the story you give of heavy bleeding is there, they may well go on and check your blood count and see if you've got any other features of an infection. They would routinely check your urine just to make sure you don't have a urine infection, which can be treated at the time. You would then go on to see a doctor, hopefully. You could then perform an examination, which would be touching you on the tummy or doing an internal examination with a speculum device. And this would be to help quantify the amount of blood loss to see if there's anything around the neck of the womb or in the vagina that was causing the bleeding. Depending what happens at that point, they may well categorize you as either having an infection and therefore needing some antibiotics to help treat the infection and hopefully stop the bleeding, or go on to get you a scan of the womb itself to see if there is any bits of tissue left behind. And if there are, they will then discuss the best way that they manage it in their unit. And that could either be with some medication to help evacuate the wound or with a surgical procedure to help clear out any retaining tissue. This video is for educational purposes. I am not your doctor, but I want you to use the information to assess your own symptoms and take it to either your midwife, your GP, or your obstetrician for further investigation. Share it with a friend, share it with your partner, because chances are you may well know someone in your network that has experienced this. In my next video, I'm going to be speaking about the effect of having a postpartum hemorrhage on your lifelong health and how it can affect other parts of your health, and why it's really important that not only is it recognized, that you make changes to your lifestyle in order to optimize your long-term health. So I want you to remember the takeaways, the red flag symptoms I've mentioned, which I'm going to put in the description box below. If you have bleeding that's getting heavier, smellier, or thicker, you need to see a doctor, and you need to see a doctor quick. Thank you so much for watching. I hope to interact with you in the comments below. Don't forget to subscribe, and I'll see you in my next video where I'll be talking about anything and everything to do with postpartum recovery and beyond.